Live. Prime Minister Dr. Keith Rowley is hosting a press conference to update the nation on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Diplomatic Center in St. Anne's.
Good afternoon, ladies and gentlemen of the media present here with us at the Diplomatic Center. Good afternoon to those of you who are following us outside at home in Trinidad and Tobago and outside of Trinidad and Tobago. Welcome to our weekend briefing on Trinidad and Tobago's response to the challenges we face, particularly the COVID-19 challenge. Today we have our usual team from the Ministry of Health, and I would like to begin by asking Chief Medical Officer, Dr. Parasram, to give us, along with his staff members, the vital data and preliminaries of our statistical analyses from Dr. Hines, and then I will come back, take it after that period, and please hold your questions until after we come to the point after I introduce some matters to you later on. So hold your questions. Dr. Parasram, please.
Okay. Thank you, Honorable Prime Minister, ministers, members of the media, members of the viewing and listening public. I'll first give the introduction with the clinical update, and then Dr. Hines will go into a little more detail with regards to the epidemiological status to date. So as of 4 p.m. yesterday afternoon, the 6th of November, the clinical update, 33,861 persons tested, including the private sector test, takes us up to just over 54,000 in total. Our total positive cases so far since the 12th of March, 5,798. Total recovered patients, 5,084. Total active patients now, 603. Number of deaths, 111. Total positives over the last 24 hours, 24. The total persons at step-down facilities, 28. Those at quarantine facilities, 304. And in home isolation, we have 507. As it relates to our hospital occupancy at this time, we have 44 persons in hospital, spread between a few facilities, the Couva Hospital and Multi-Training Facility, 3 persons in ICU, with 30 persons occupying that facility in total. Cora Hospital, there are 12 persons, and at the Scarborough Regional Hospital at the Fort, there are 2 individuals. With regards to our step-down transition facilities, there are 28 persons. At the Claxton Bay Correctional Facility, there are 13. The UE Day Bay site, 15. In terms of our quarantine sites, we have a number of sites being occupied. The Regent Star Hotel, 25, Cascadia Hotel, 26, Paria Suites, 68, Chancellor Hotel, 7, Freedom Hall, 26, Canada Hall at UE, 35, the Home of Football, 42, Davy Halls, 45, and UTT Valsign, 16, and overall occupancy rate, 19 out of 21 centers being used at 21% at this time. Prime Minister, Dr. Hines. I'll just introduce Dr. Hines to start the epidemiological update.
Thank you, CMO, Honorable Prime Minister, Honorable Ministers, colleagues, members of the media, members of the viewing and listening public. As we had been reporting over the past couple of press conferences, what we've been seeing over the last couple of weeks, maybe about 2 weeks, is a virtual plateau of cases with a very slow decline in terms of average number of cases per day. As at yesterday, The average number of cases over the previous 7 days was 20 cases per day. And we're hoping that we continue to see that slow but steady downward trend as we move forward. But we do have to bear in mind that today marks the end of that 2-week period within which we expect now to see the effects of the changes that we would have made 2 weeks ago. So while we were seeing a trend, which was a slow downward trend, a plateau, we are now looking very closely at what we see coming out over the next week or two as it reflects the impact on the numbers that behaviors, activities, new movements as a result of the reduced restrictions would have had on the spread of the virus. We are hoping that the public has been adhering to the guidelines regarding physical distancing, mask wearing, hygiene, and we are hoping that those guidelines, the application of those behaviors, will blunt any sort of rise in the number of cases, but we're observing very carefully. This is really sort of a delicate period where we are looking to see what will happen against the backdrop of what we have changed already. So again, what I can do is continue to encourage the population to do what we've been asking all along, even as we move a little more. The enhanced hygiene, the enhanced mask wearing, the enhanced personal responsibility of not going to work or into gatherings when you're ill. These things make increasing amounts of difference as we move forward. Prime Minister.
Thank you very much, Dr. Hines. I would like to ask the Minister of Health to give us the international perspective.
Thank you. Thank you, Honorable Prime Minister. Fellow ministers, Chief Medical Officer, Dr. Hines, Dr. Michelle Trotman, who likes to stay in the shadows, but we will bring her up here today, ladies and gentlemen of the media, ladies and gentlemen of the listening and viewing public. When I last spoke to you in Tobago at the press conference that the Honorable Prime Minister had, I said at that point in time, which was on Saturday, the 24th of October, there were 7 countries that had 1 million plus cases around the world, 7. Today there are 9. So 2 weeks later, 2 more countries have joined that club of 1 million cases. The reason why I bring the public up to date on what is happening globally is to let you know that this coronavirus epidemic is a global phenomenon. There were 2 micronations. Micronations are those countries with very, very small populations isolated geographically. There were 2 micronations that previously had no cases. Today, those 2 micronations, very, very tiny populations, have 1 case each. The point is, it is starting to reach the furthest parts of the world, wherever people are. In that context, if you pay attention to what is happening on both sides of the Atlantic, and even countries close to us and dear to us, the epidemic surges ahead. There are many countries in the world that don't have hospital space again, that don't have ICU space, that they are taking their maternity hospitals and converting it into COVID hospitals. In light of that, and in spite of that, Trinidad and Tobago is doing very well. We are down to about 20 cases per day, as Dr. Hines has said, which includes those tested positive who come in on the repatriation flights. In that global context, our ambulatory wards are currently only 16% occupied. Only 16%. We have done remarkably well. Our ICU beds are only 16% filled at this point in time. And our HDU beds, we have no one there, 0%. The good thing about this is that the healthcare workers can continue to get a rest. And this is what healthcare workers want around the world, but we are getting a rest. In light of this, and whatever measures the Honorable Prime Minister announces today, as more and more people move And in the past 2 weeks, when the Honorable Prime Minister announced that post-secondary institutions that cannot conduct online courses, like if you have to do labs and so on, the Minister of Health, I as Minister of Health, has signed off on literally allowing thousands of post-secondary students back into their labs to do work. And I am sure that these institutions, the universities, the private tertiary institutions and post-secondary institutions, I have all faith that the COVID protocols that they say they will observe are being observed. So many more people have been moving in the past 2 weeks. As we continue to move, as we continue to have more people gather, there's a simple equation. The more we move, the more freedoms we get, is the more we need to commit to the simple healthcare protocols. And what are they? Wear your mask. I am noticing that people have stopped, but not stopped. More and more people are not wearing masks. They wear it around their chin. They talk to each other, and that's the most dangerous time not to have a mask covering your mouth. So let's recommit in this Christmas season, Diwali season, to wearing your mask properly over your nose and mouth, the social distancing. Dr. Trotman is a big fan of hand sanitization. Stay at home if you are ill. And as we move into Diwali and Christmas, my last piece of advice is avoid home gatherings as much as possible. I will give you one last example before I turn over to the Honorable Prime Minister. My daughter, as you know, is a doctor in England. Right now, she has a grandfather, an elderly patient who is currently dying. And do you know why? He went to his granddaughter's 5th birthday party. His granddaughter at the time was asymptomatic, subsequently tested positive for COVID. And poor granddad, who went to his granddaughter's home birthday party, is now dying. So I am urging the population in this festive time, religious time of Diwali, coming into Christmas, the elderly especially should avoid gatherings, and let us keep our elderly safe. Thank you, Honorable Prime Minister, and back over to you.
Thank you very much, Drs. Parasram and Hines and Minister Dayal Singh. I think this afternoon is a good time for us to review what we have done, why we're doing it, in the context of the conversations that took place in the last 2 weeks since we met. I must say that I have confidence in the people of Trinidad and Tobago. And in the last 2 weeks, that confidence has been shown not to have been misplaced. Ladies and gentlemen, boys and girls, the reason why we are doing all of this is because for all of this year, we have had to respond to a virus which turns out to be airborne and which can be transmitted as we move around, as we interact. What did we do in the beginning? We virtually prevented ourselves from moving around and significantly reduced our interactions. That model remains intact. The government, on the advice of the virologists, the epidemiologists, the public health specialists, told us in the beginning, if you may recall, in the very early days, we focused very heavily on the washing of hands and keeping hands from faces. That's still important. But then a little later on, we discovered from the rest of the world, those who were ahead of us, that there were aerosols produced by human beings, and the virus could be transmitted in the air from one person to another. That caused a certain amount of increased concern and the reactions that went with that. That is when we started talking about using the mask, and then it was confirmed that by using a mask, you could suppress the amount of transmission that's taking place, and we got to the point of making the mask mandatory. But from the very beginning, even though we were facing a situation which by the time was very horrible in Italy, we had to have some exposure. And in Trinidad and Tobago, we accepted a level of exposure through what we call the essential services. And those were health, of course, water, electricity, national security, food production, and health construction. Even as we had locked down the country and hid ourselves away, those areas were left open to function because we needed to have them to function if we were going to have any semblance of support and service. And those areas, oil and gas, remained functioning, even with international connections. Our staff were going back and forth, international staff was coming, the rigs remained operational, national security arranged to make people come into the country, go straight to the rigs. When they came in for quarantine, we quarantined them safely. And I must say today that that was a very successful exercise, very successful. And of course, I'm very happy to hear the numbers that we are told about today, which gives our healthcare givers some element of rest. Many people may not understand how important that is, because at the height, at the peak of what we experience, and in preparation and in providing that healthcare, there are many hundreds of staff members in the healthcare system who were literally working, running themselves off their feet. And to now have an opportunity to not have patients in front of them and to have a rest, I think that is something that we should applaud and hope it lasts for quite some time. The food production systems, local food production systems, have gone on, and we are seeing some good results from that. If you go outside, you will see what's happening among the farming community. Well, of course, national security and public utilities have remained intact throughout. And we did shut down manufacturing because the requirement to respond was to cut down that interaction and that movement. So while we left that block of people I just mentioned to go about doing what they were doing because those were the essentials that we had to have, we shut down manufacturing. We shut down construction, except construction that was involved in health facilities. We shut down transportation. And of course, we shut down places of worship. We shut down recreational and entertainment. And most importantly, we shut down our school system, from tertiary to kindergarten. And we encouraged a reduction in the numbers of people interacting even at the family level. That is how Trinidad and Tobago responded to the requirement to keep people away from people so that the virus doesn't jump from one to the other. During that period, no amount of advice was coming the government's way, especially from persons who might just give the advice because they think it is to be different to what the government was doing. But the government said to the people of Trinidad and Tobago from the very beginning, whatever action we take would be guided by the science of the virus and the advice we get from our public health care givers. And again, I want to thank all those who have been involved in providing that support, that advice, that field support to patients, to the government, and we have stuck with that. As a result, today, I can tell you our country is one of the few countries in the world that is opening up and going back to some semblance of normalcy. Even as we acknowledge that, as we do that, we are taking a huge risk because persons who have done that before us, countries that have done that before us, many of them now are experiencing huge negative reactions and are going back to even shutting down the sectors that I have just mentioned. Total shutdown. There are many European countries in which you can't go to a pub, you can't go into a restaurant, you can't do the things that we now take for granted. While we, in fact, in Trinidad and Tobago, we are doing the opposite, slowly, cautiously, carefully, but going in that direction towards greater improvement and greater activity. It is shocking then, in that situation, to hear persons who appoint themselves as spokespersons for the country to say that what is happening in Europe is not relevant to Trinidad and Tobago and something else is relevant. I want to say to those persons, what is relevant to the people of Trinidad and Tobago is to stay alive, stay healthy. And everything else is secondary. Everything else is secondary. And that is the policy of the government of Trinidad and Tobago. Because in the absence of that, I don't know what could happen to us, except that we compare ourselves with other people who have done differently, and we see the results. There was one particular country in Europe where they took an approach of trying to walk between the raindrops of the virus, which is, that country is now being soaked and is probably at the peak and the pinnacle of the spread of this virus. And if you think it's just getting sick and getting the flu, as some people say it's just the flu, look at the death rate. The daily death rate in those countries is horrendous. I mean, many of us have family in the United Kingdom, in the United States, and other places. You see what is happening there. It is because the virus has found a way to go from person to person in a way that it has not found in Trinidad and Tobago. But as we open up, where are we now? Early November. Because we've been on this since January, and mainly, one can say since we shut in March, right? Yeah. We are now in November. Where are we? All the essentials are still operating as they were in the beginning. We had even said at the time that even as they had essential services, that only the essential people in the essential services should come out. That's as far as where you went. So if you had clerical people that you didn't need in the essential services, don't bring them out, don't bring them to interact. But we rolled back from that. The essential areas are still functioning. Manufacturing was one of the first areas that we opened up. And I remember going out and touring a few factories nervously, meeting and seeing our workers at the factory floors, and I knew that they were in the forefront of our coming back out from that shutdown. Very scary. Manufacturing is still operating. Construction, there's no restriction on construction. Construction workers have been back out and going on. Transportation, we eased back in from wherever we were, 25%, 50%, 75%. Transportation, right? Road transportation, sea transportation. We had put restrictions on the inter-island ferry transportation, air transportation. We've eased that up a bit, and we've done, the last time we met, we asked Kyle, and Kyle has increased those. Places of worship. Many people were suffering. Many people who rely on that daily interaction in the place of worship. And the churches were closed, places of worship were closed, mosques and mandirs. We've opened them back up a bit. We've given them small numbers, and we've given them larger numbers. Now they're operating at 50%. And of course, last time we met, we said that those people in the education system who need to go to laboratories to do their work could do that. All of that, all of those areas, every time we bring about some rollback, what we would be doing, or what we have been doing, is increasing the number of people who are coming out and interacting and taking a greater risk. And as we do that, when we meet, as we meet frequently, we look to see what is the effect of what we have done. Because the biology of the virus is such that if you get infected in a particular day, and we are told, and we're working with a 14-day incubation period, that during that 14-day period of exposure, when you've been exposed, something could happen if you have been, in fact, infected. So whenever we make these openings up, that might look insignificant to some people, the virologists and the epidemiologists and the public health experts have to look to see what has been the effect of that. Once or twice we've seen the effects, that they were quite negative, and we had to immediately step in, because if we don't step in, if you see it going in the wrong direction, in only a matter of a few days, the curve jumps up. Maybe Dr. Hines might want to tell us, before we leave today, how we have moved with respect to the doubling, because that's the graph we need to look at, how long it takes us to double the numbers from day to day, from week to week. We've been using the week-to-week chart. And you could see, and if you're looking at it, and you see how many days it takes to double the numbers, and it doubles the numbers in a shorter period of time, and a shorter period of time, then you don't have to be a mathematician to know what is happening to us as a country. That very soon, It's going to reach the point where out of the large numbers of infected people will flow a large number of sick people requiring hospitalization. And if that number is large enough to overcome our health preparations, then we would be just like some of the countries that were mentioned by Minister Dayal Singh a while ago. And I want to say to those persons who appear to be impatient with respect to our return through this maze of danger, that grasping for a perfect state now, for the reasons being given, if we do not let the science guide us and the patience work, we could throw away everything that we've done so far. Because when you get to a stage, like some European countries have got to in recent weeks, the only response you can make to that is to go back to a serious piece of shutdown and restriction. And that is where the real hurt will come. I know that hurt is being experienced in the few sectors that have remained closed or restricted. But I want to ask the persons involved to understand that that is minuscule as compared to going back. Minuscule in terms of the scale and the numbers of people who would be affected if we have to find ourselves back in a situation that we were in April. So whenever you want to talk about the Prime Minister's intervention and the CMO's intervention is nonsensical and that we don't understand this and we don't understand that, I want you to use the yardstick of April. Because if we bite off too much, when we choke, we're going to have to go back to where we were in April and restart the whole process again. It is not my intention or the intention of the government or the health department to risk the gains that we've made. In fact, I'm looking at it differently. If we continue to progress in this way, to have more and more activities, to have more and more people out with activities, I am hoping that we would be in a situation in January where we can get our children back to school. That is my next big hurdle. Will our children be able to go back to school? We have already said that there's going to be no carnival because we cannot really see a situation where you can have a carnival given what we are fighting and have been fighting since January. So we can make that call now. We've made that call already. We kept our children away from school for a long time. We brought them out bits and pieces to do certain things, but I am hoping that if we stay the course and we get the results that the scientists and the data can tell us that we can get, if we do certain things and deny the virus the propagation that it would like to have, that I am hoping that we could be in a situation in January to have in Trinidad and Tobago our children out to school. Whether it's for 1 day a week, 2 days a week, I don't know. But I'm just saying that is my hope and my anticipation. But that could only happen if we keep the numbers going in the direction that they're going now. And we will not do that by throwing up our hands in the air and saying, party time. We have beaten the virus. There's no virus. And I want to say to the people of Trinidad and Tobago, we've taken you this far, so far. Please make your decisions based on the advice of the health services of Trinidad and Tobago. Other advice may be experimental and the outcome is unknown. We are going into Christmas. The Minister of National Security could probably join us at this time and tell us what's been happening with our response to our population, home and abroad, especially those who have been abroad. Because when we drew that line very quickly and closed the border, we had this issue of what happens to those who are on the other side of the border and what happens to those who are inside the border. And that interaction has been one of the areas of discontent as we went along, but we've been managing it, and I would like to ask the Minister of National Security to give us an update as to what has happened so far, where we're at, and as we look ahead to the Christmas season.
Thank you very much, Prime Minister. Good afternoon to my cabinet colleague, to doctors, members of the cabinet colleagues, doctors, members of the media, wider viewing and listening public of Trinidad and Tobago. I have some interesting data and statistics for us here today with respect to how we've been managing the borders, and in particular the numbers tell a very interesting story. What I can tell you all is currently the number of individuals who have applied to enter Trinidad and Tobago as at yesterday's date, the 6th of November, is 13,042. So those who have been following, you would notice the numbers just continue to rise. The number of exemptions granted to persons to enter Trinidad and Tobago as at yesterday's date, the 6th of November, 7,204. So that leaves currently 5,838 outstanding applications to enter Trinidad and Tobago. However, what I did is ask for the numbers as at the 1st of August, all right? Because I figured the cutoff period really of the 29th of July, how many people had applied to enter Trinidad and Tobago by the 29th of July. And that would give us a reflection of those who were stuck, unfortunately, outside when this global pandemic began to take place and we closed our borders on the 22nd or 23rd of March. The number of individuals who had applied to enter Trinidad and Tobago as at the 29th of July 2020 was only 5,539. So when you marry that with what I've just given you above, of a current total of 13,000, and we've granted exemptions for people to enter Trinidad and Tobago of 7,204. It tells us a story. So what you're seeing is that the numbers continue to rise. And the breakdown of those statistics, as I've been discussing with the Honorable Prime Minister and other members of the team, is we have persons, as I've said before, who may have been domiciled outside of Trinidad and Tobago, so the nationals of Trinidad and Tobago were making their lives elsewhere, who joined the queue to come home. And now we're also having two other categories of persons add to that 13,000 number. Those two categories of persons are all of our flights that have been leaving Trinidad and Tobago since we've resumed on a weekly basis, a 10-day basis. We have flights going every 10 days to Barbados, New York, Miami, and in between there we throw in a flight to Canada and some other jurisdictions. Once our quarantine facilities can manage it, persons are going out. So the two other categories that we're now conscious of are those persons who, I don't know how to put it, but jump on those flights to leave, and they expect to then immediately turn around when they finish their business outside and join, and sometimes demanding they jump the queue to get back into Trinidad ahead of those who were stuck outside. That is something our policy has been fighting against, because we've always prioritized those who were stuck outside when we closed our borders. And when I gave you those numbers today, we believe that the vast majority, there may still be some, I'm not going to say all, of persons who unfortunately found themselves on the other side of the border when we closed our borders outside. We've gotten back the vast majority, and we will continue. I've assured the Prime Minister in the next few weeks to make sure we do all that we can to get those back home. So the first new category, Prime Minister, is those who have gone out on these flights and now are looking to almost immediately turn around and get home. The next category that we're very conscious of, and the Prime Minister will touch on it, I'm sure, in a short while, and I can come back up and give some further information, is persons who want to come home. So we may have had students who are studying outside, they want to come home, other nationals who are accustomed coming home for Christmas, or to Trinidad, who haven't come home for the year, they also now join these numbers. So Prime Minister, those are the two real new categories in addition to those who are stuck outside.
Thank you very much, Minister Young. So bear in mind what I said to you, that we are very slowly, cautiously opening up, exposing, increasing the risk that we are taking and holding. We're getting the benefit of good behavior. When I spoke last time and I said the beaches are open, I did appeal to you. I think I spoke from Tobago then, no? Yes. I was in Tobago. Yeah. And I appealed to you not to go and congregate on the beaches. I can tell you today that the information that I have is that the beaches have been open now for 2 weeks and they're being used, and we did not have on this occasion what we had on the first occasion when we opened the beaches. And I think that is a good sign that we could do things without doing them badly. So the beaches are open. We still keep the rivers and ponds closed, but as we improve our condition, we expect that other interactions will come. Today, we want to look, because we want to take a little more of what we think we can take, given the fact that the numbers are relatively good, which allows us to do a little more that I'll mention here now. At restaurants, we are prepared to allow in-house dining at 50% capacity, seated in groups of no more than 10. And we're asking restaurateurs, as far as they're able to maintain separation within your establishment. Just remember, it is virtually impossible for the government or the police to be over every plate. But if you inside the restaurant can take on the responsibility to make sure that your clientele is spaced as much as you can, but also as you feed them with food, we are saying no alcohol to be served. Alcohol has been shown to be one of the contributors to the results that we don't want, where people consume alcohol and it reduces their level of responsibility. So for now, because we require a higher level of sustained responsibility, we are allowing dining without alcohol, groups of no more than 10 at 50% capacity for the time being. We are prepared at this stage to allow food in cinemas. I hope that those who use food in cinemas would only keep their mask off while they're consuming food. The expectation is, I understand CMO and others that there are certain protocols that I don't speak to here that cover certain operations. And you will see that those protocols are kept by those persons who are the beneficiaries of the changes that we're making. So if you are patrons of a cinema, you'll be there for 2 hours, or 1.5, 2 hours. If you do have to eat, well, of course you can't eat through a mask, but soon after you finish eating or whatever you're drinking, keep your mask on inside. And they are also to continue operating at 50% capacity with the requisite separations. We know that we have a number of sporting teams who are anxious to get engaged in preparations for competition, home and abroad. We are now going to allow all sporting teams that are engaged in national competition, international competition, those teams can now go back to activity, full activity. And of course, if they are to have persons other than members of the teams around, that they remain groups of no more than, we are without spectators now, but groups of 10, support of the teams. For example, you may have a parent or two, or you may have support staff, and so no more than 10 additional to the. It is our hope that if the numbers continue to go in the direction that they are going, that when I speak to you again in the time frame in which I've been speaking to you, that we should be able to do a bit more with respect to sporting activities. If we do not see negative reactions to the opening up that we're doing now, we will allow more casual sporting activity in the context of what I've said early on. So patience, that's coming as long as the good numbers keep coming. We have asked Caribbean Airlines to continue to improve its service to Tobago in terms of its numerical offering, to add flights based on demand, but to maintain the social distancing and the rigid enforcement of mask wearing, and also no congregation, the distancing at both Trinidad and Tobago airports. So we expect to get a bit more people going to and from Trinidad and Tobago. So Caribbean Airlines is familiar with that and the protocols that they are following. And as you use that service, please remember, it's a restricted service, but less restricted now, and you have to look after yourself. You're on the plane, you're in the airport, you're on the way, so please continue to look after yourself. We know that there will be people who would be saying that they are being hard done by. But I want to ask you to be a little patient. Places of worship, when we spoke last time, we said we allow 1 hour. Today we're going to extend that to 90 minutes. So your church services in your mandates, your mosque, wherever you worship, you can spend 90 minutes. So that is how we go, increasing the exposure. We're not making any changes today to the educational system, and we are not going to make any further changes in the area of recreation and entertainment. I know that the people who operate bars are anxious to open their bars, but I simply want to say that when we are called upon to restrict the activities that we engage in, we just had to prioritize. And entertainment and recreation were areas that we had to give up if we were going to keep health, water, food production, construction, manufacturing. So for a little while longer, we would hold the current situation. We have not shut down entertainment at bars. We simply have a restriction. The restriction is that you can be serviced, but you are not to congregate. And let me point out something. The reason for that is that it's not because we are against beers and rum. It is because beers and rum are available away from bars. They're available. Because if you really have to have it, it's available. But when you go to the bars, there's another component. That is, it is to congregate. It's that social congregation. That's what happens there. And the information, both local and foreign, have indicated that that is an activity which has facilitated the spread. Unfortunately, those are the facts. So we are saying, for the moment, we are going to have to give up that exposure. We've taken exposure elsewhere, but we're going to have to be a little more patient with that. And we will, at the Ministry of National Security and with Caribbean Airlines and the Ministry of Health or Infrastructure, as far as we are able to, we will try to meet the emotional needs of those people who want to come home for Christmas. We have some protocols that we want to outline, and I think the Minister of National Security will outline that to facilitate greater movement of people in, because the Diwali season is upon us, and the Christmas season is virtually upon us, and we know that there are people who waited out hoping to come home for Christmas. Persons who may want to go out for Christmas should know that if you go out for Christmas, that you may not be able to come back in immediately, because we do have a line. And those who are outside, who have been patient, who are wanting to come for Christmas, it would not be possible this year for everybody who wants to come home for Christmas to come home for Christmas. Let me make that clear. We do not have the health cover to allow everybody who want to come home. Because if we do that, especially where we know they'll be coming from, two of the most high-risk areas, it would guarantee us a situation where we're going to have an explosion. And as I said, we are going to give up certain things to get certain things. We're aiming to be in a position to have our children go to school in January, if we can manage to have our numbers in a way where our children can go out safely. So, but we will have a pathway to get as many people home as possible, as safely as possible. And Minister Young will outline the protocols involved with that.
Thank you very much, Prime Minister. As directed by the Prime Minister 2 weeks ago, we've worked with the Ministry of Health and also sought certain advice from the Attorney General. And from the 15th of November, which is next weekend, we're going to be introducing the following guidelines with respect to repatriating persons to Trinidad and Tobago. So from next weekend, on the 15th, we will be requiring persons entering Trinidad and Tobago to have a negative PCR test 72 hours before entering Trinidad and Tobago. This is an international travel protocol that has been going on. Most of our CARICOM neighbors have already introduced this. So from the 15th of November, we will be requiring persons coming into Trinidad and Tobago to have a negative PCR test within 72 hours prior to entry. Upon getting into Trinidad and Tobago, we will still require persons to go into state quarantine, which is where the state covers the cost, or state supervised quarantine facilities for the next 7 days. We will test persons who have entered with their negative PCR test on the 6th day of being here. And once you present your negative, that second negative as we call it, on the 6th day when we test you, once you present thereafter, you'll be released and you can go home. How we're trying to increase the numbers of persons that we can manage. We've always said that this repatriation process depends heavily on the quarantine space that we have available. We have agreed to now introduce another facility as a state supervised quarantine facility. We've already started the preparations, had a conversation with them yesterday, and the Ministry of Health is on it today. This is the Cape Park Hotel. It's going to give us almost an additional 100 rooms. And what I'm asking, Prime Minister, is the persons who may be fortunate enough to get into the queue to come home for Christmas, we're going to be asking as many of them as possible to utilize the state supervised quarantine. So in other words, pay for the hotel facilities for your 7 days on arrival, because it increases the amount of persons we can manage in our quarantine facilities. So we're adding the Cape Park Hotel. That is in addition to the Chancellor Hotel, Regent Star Hotel, and the Cascadia Hotel. All of the other facilities will be maintained, and those are the state quarantine facilities. And this adds an additional 100 rooms, and that multiplies, because of course if you have families, then you can have one family in one room depending on the size of the families, etc. We will put on more flights according to our ability now to manage more persons in. We are going to continue the 4 flights, direct from Miami, direct from New York. We're going to add on as many of the Canadas as we can, and we may move that around because the numbers left in Canada are very low right now. And of course, Barbados, we will continue our weekly flights from Barbados, where a lot of our nationals are coming in from other jurisdictions. Prime Minister, if you would allow me, I'd like at this stage as well to thank all of the members of staff who have been managing this border system since March of this year. It has not been an easy time, especially those on the front line, and it would be remiss of us as the government not to thank them. That is the team at the Ministry of National Security, the team from the Ministry of Health, including the Port Health and the frontline workers, Immigration, Customs, the Trinidad and Tobago Defence Force, the Trinidad and Tobago Police Service, Civil Aviation, Airports Authority, GMRTT, that's the ambulance service, and to assure the population, Prime Minister, that the Trinidad and Tobago Police Service, who have been on the front line since March without break or relaxation, will continue to do all that they can to maintain and to enforce the regulations. But honestly, it comes down to each person's personal decision to be able to just do what you're supposed to do. All right, and what we'll do is, of course, when we're doing this new increase of repatriation system, if you can indicate when you're contacting the Ministry of National Security that families and persons who are willing to go into these rooms and into quarantine as a family, and give us those numbers rather than us having to work it out. It allows us to bring home more people on each flight. And we expect that with this increase in quarantine facilities, as well as the number of flights we can then put on, once it's done properly, that we will be able to assist, as the Prime Minister said, some, not all, who want to come home. And then there are also those who maybe after the Christmas season, you can then come home after we've cleared that crowd. I mean, there'll be students coming as well. And one of the conversations we were having yesterday was just make sure and calculate your days correctly. This is the new system. You're coming in with a 72-hour negative PCR test, and you are going to go into quarantine for at least 7 days. We'll test you on the 6th. So work out your date with Christmas and understand that if you come in at a certain time, that is 7 days before that period, before Christmas, you're going to spend quarantine in Christmas. All right? Christmas in quarantine. Thank you.
Thank you, Minister Young. Yeah, we need to get that clear because we require to have the quarantine system operational. It is reasonable to work out that you can't come in on Christmas Eve Day to spend Christmas with the family. If you come in anytime under 6 days before Christmas, you will not be able to spend Christmas Day. So if you want to spend Christmas Day with your family, you need to arrive in Trinidad and Tobago with a negative PCR test at least a week before Christmas. So come early for Christmas if you want to spend Christmas at home with the family. If you do come in, as I expect some people will come, nearer to Christmas, but in so doing, you will only see your family after Christmas Day. Now, this is not something that we could have anticipated before. But ladies and gentlemen, this is the demand of the pandemic. If we try to please and to dampen the grumbling by doing otherwise, the consequences could be grave. Let us for one moment say, all right, Caribbean Airlines, bring home as many people as you can with the planes that you have. And anybody who wants to come home, just come home and go home. What do you think would be our position in 14 days' time? I could tell you what it's going to be. It would be that we would be in a situation that gives us no chance to do the positive things we want to do. And we would certainly join the queue of people who are rolling bodies out of their morgues and having their hospitals overrun by people who need hospitalization. So we can't have that. So whatever we are doing about bringing people into the country, those controls that Minister Young has just outlined are the controls that allow us to do that bringing in while preserving our health status as far as we are able to, following the other protocols that are in place. So those are the positions from today, and we'll take some questions from you now if you do have such questions.
Prime Minister, good afternoon. You mentioned transportation, and the public service transport sector is still operating at a reduced capacity. Has any thought been given to getting them back up to full?
Our public service, our transportation is now, we are at 75%, but we did remember when we were at 50% or something like that, and we met with them, and we looked at the configuration of the vehicles, and we maximized the amount of people that they can carry, while at the same time allowing some element of physical distancing. So that is working fine as far as I know. I'm being advised that they have said that that is okay for now, given what we are being called upon to do. Yes.
Prime Minister, question. So given the fact that we know by now that COVID is going to live among us for some time, will the government ever consider at least suggesting to the financial institutions to defer some of the payments for those who would have been affected by the pandemic?
We've done that at the beginning. We've done that at the very beginning, and I think we are at the stage now where those institutions, they need you as much as you need them. So if we all are going to live with the virus as we all are, I'm expecting that whatever has to be done in addition to what we had put in place in the beginning are going to be applied. Because, you know, when you start, there's a knock-on effect to everything that we do. It doesn't, you don't do one thing and there's no reaction to it. Because, for example, you know, if we say the bars are not going to be open, you hear the conversation about the loss of jobs and the absence of rent being paid and the landlord not being able to pay the bank and the bank saying that, look, I can't carry. So it's a cycle. So in there, you will expect that they will make adjustments to keep their clientele alive. No parasite wants to kill his host, right? But usually they might do that. So maybe you get to an epified situation where they hold on and everybody survives. The banks need the customers as much as the customers. If there are no customers doing business with the banks, what do you think is going to be the bank's position? So they will have to make some kind of adjustment where they think those adjustments will keep their customers alive and well and keep them doing banking business.
Can we get an update on the border committee as well as the CARICOM bubble? I mean, what has been happening? You said in 6 days they were supposed to report.
That CARICOM bubble was an attempt to create a space within which we could all operate and allow the external to be on their own. But from the very beginning, you would have observed that what we wanted to do at different locations, in different situations, it was difficult to get agreement as to what this bubble should be because we were in different situations. So while we did talk about a bubble, it was difficult to manage and maintain. You can't have a bubble with some people sticking their heads outside of the bubble, you know? And eventually we got to a situation where the protocols were not effective in preserving a bubble. What people have been doing now is develop site-specific, nation-specific protocols and to see where there are commonalities. Like we have had connection with Barbados continuously throughout this. And we've improved, we've had it with Guyana, we've improved with Guyana. And I'm in conversation with the Guyanese authorities to see whether we could improve this further. But remember, any door you open, that door is not just open to the people that you're talking to. It might be open to the world if there's another door in the back open to the world out there. So that bubble is something that is more, I don't want to say fantasy, it's more of an expectation rather than a reality. And different people have different priorities. There are some CARICOM countries that very early had to open their transportation systems because they're relying on tourists. And they had some success initially, and there was one country that after 2 weeks had to go to a full-fledged lockdown because the virus had gotten away in that. There's another country that for a while had, it appears as though that their model was working until the virus splurged to community spread. So there's a lot of practicing to see what works and to see what we can get away with. But there's no real bubble as such within which we are secure as countries to move around in there.
So while the aim is to get our numbers, daily numbers lower, at one point the aim was 20 a day to be included in this bubble. This is no longer a consideration.
It's not, well, if there is something that we can participate in because of that, then we'd be happy to qualify. But if there's nothing, we keep working our numbers to suit ourselves, right? But of course, just remember that it's an ongoing process with a moving target, totally controlled by what the result is as we make our movements. Right? That is what we are more focused on. What kind of reaction are we getting from our people as we make the changes that we're making?
Food being allowed back into cinemas and no alcohol for in-house dining. But what is going to be the process now for casinos and members clubs?
We have not made any changes in the casinos and members club. They remain on the protocols that we've outlined. Right? So we have not made any changes there. What they are doing, we'll do that for a while longer.
And in terms of prioritizing nationals, again, we have a question coming in from social media here. Would priority be placed on nationals who've been stuck outside, who lost their jobs?
I'm sorry, I'm not hearing you clearly. Could you be a little clear?
Priority be placed on nationals stuck outside who would have lost their jobs, running out of funds, and they will be given priority in terms of the repatriation efforts.
So that question sounds like the second category of persons that I mentioned, right? So we realized some time back that we have nationals who are making their lives, as I put it, they were domiciled outside of Trinidad and Tobago and may have met unfortunate circumstances, and you've just confirmed it. We will continue to maintain the system that we have now. The statistics I gave this afternoon were to show the population and those looking on that we believe we've cleared the vast majority of persons who were stuck outside when the borders were closed. But we will continue to have our prioritization and our policy. Everything is done on policy at national security as to how we repatriate persons. So I'm being bombarded here as well. So those persons, if they're in the queue, then they're going to reach. Now we're adding another category of persons, those who we recognize, students and others who want to come home for Christmas. Those will fall into the sort of outside category when we're still dealing with those who have already been in the queue. And just to clarify, Prime Minister, because persons are asking, the same travel exemption system remains in place, all right? So what we're going to do is ask people now to just provide that additional information that we've asked for. We'll develop it. We'll get a proper statement out with respect to how it should be done, but the same travel exemption at mns.gov.tt remains in place, and we'll continue to maintain it with the policies that are in place. So the category of people that you've just described, we are aware of. I can't say that they will jump the queue. They may jump the queue over someone who just wants to come home for Christmas for a 2-3 week period. But we are doing all that we can, and we have cleared the vast majority of the backlog, which was our priority.
You're at the podium. More than 20 remand yard prisoners would have tested positive for COVID in the last week. What measures being put in place to protect the rest of the prison population and the officers?
All right. It's actually not the remand yard. So what it was is maximum security prison. Last night, the chief medical officer and myself were discussing it. And I then got on to the commissioner of prisons and his team at prisons. Fortunately, from day one at the prisons, we built out parallel systems, similar to what health had done. So we have a number of parallel systems in prison. I don't want to talk too much about where they are, etc., that are in existence. So when we got those 19 positives from maximum security yesterday, we were able to move them to the 18, sorry. We were able to move them to the parallel healthcare system that we've built out. And actually, when I spoke to the commissioner last night, they were in Tobago and asking me to commission tomorrow the prison facility for persons who are positive with COVID from the Tobago prison in Tobago tomorrow. So we are up and running with that. I'm not going to commission it. I told him, go ahead and do it. I have other commitments. So the message I want to get out is we had already put things in place. We have parallel systems in the prison system to move persons out from the time they start to show any symptoms, any flu-like symptoms. We immediately ring-fence them in other areas of the prison. If it escalates from there and we get the positives, we can move them to other areas that have been prepared specifically for that. We also have facilities for persons who may be arrested and have to enter into the prison system, where we put them, quarantine them for 14 days before then putting them in with the rest of persons. So one of the risks here is persons who are coming and going into the prison, and we're doing the best we can. But fortunately, we had built out some parallel systems from very early o'clock, and knock on wood, they've been working. And I thank the Ministry of Health for their assistance with it.
Some fans returned to horse racing on Santa Rosa Park last week. Can we get a comment towards that, please? Are they going to get official permission to do so soon?
Well, we are outside of the protocols that we put in place and the areas of activity that we have identified. Anybody doing anything else is running afoul of the law. So that's a matter for law enforcement.
You mentioned the return of the go-ahead for competitive for national and international teams. What about international competitions, competitive teams locally, persons who are involved in like zonal clubs who may be...
Not yet. No, not yet. The national teams. Right? Yeah. What I did say is that we hope that if our numbers remain traveling in this direction, that maybe in the next 2 weeks or so we can go back to a wider open sporting activity.
Include recreational sports, water sports, anything at all. Everything is still remains.
Not just yet. Just remember what we said earlier on: interaction and movements. Certain interaction and movements we have to give up to get certain other things.
Well, since there's no more COVID, I hope you don't mind if I go.
No more COVID?
No. There is COVID. Don't tell the public there's no more COVID. Please. Be serious. Be serious.
I waited for a long time. I waited for a long time to hear that being said. But unfortunately, you're a bit premature.
I have one more. Go ahead.
Yes, you have one more. You have another question. Yes, please put your question. If you have a question on another subject, we'll take that too, but not prefaced by that. Yes.
My question is to Minister Dialsing, and forgive me for not introducing myself before. Kimberly D'Souza from TTT News.
Hi, Kimberly.
Minister Dialsing, I know you normally give us an update on the number of tests at the beginning of the month, every month. Do you have those figures for us today?
Which tests are we speaking about?
Test kits we have available.
Test kits. Oh, yes, sorry, yes. I have it. If you give me test kits. Yeah. So I normally get a report on Monday of any week, right? So this report is a few days old, but it's still good. On the BGI tests, these are not rapid. These are the PCR tests we get from China. On Monday, we had 18,000 on hand, but we have 20,000 coming in. So we have a rolling order of about 20,000 per month. The reason we can't order more than that is that it comes with a 6-month expiry date. So it's a really short expiry date. The Abbott system, we had a total of 29,472 as of Monday, and we have a rolling order of 20,000 again. The Gene Expert, we were down to 120, and the Gene Expert is now no longer available to Trinidad and Tobago. And let me explain why. The Gene Expert kits are being distributed through the United Nations, through the UNDP. And when we got our first batch, way back in March, April, I believe, we got about 5,000. Since then, the UNDP's policy and the manufacturer's policy is that Gene Expert tests should only be available to low and middle income countries, especially in Africa. We tried valiantly for about 3 months to get onto a list to get Gene Expert, and the UNDP is very firm in their policy. We even reached out to PAHO. I myself reached out to UNDP. So Gene Expert will no longer be available, but we had 120. But the good news is, luckily, the rapid antigen tests have come in, and the CMO and I have agreed, and everybody else, that is a more than adequate substitute for the Gene Experts. So we are well supplied with tests. And on top of tests, you also have to have swabs. As of Monday, we had 43,000 swabs. We're in a very good position. And last note, all the rapid antigen tests come with swabs. So we don't have to import swabs with that. So that is where we are with tests. And this is as of Monday of this week, gone.
At funerals and weddings?
Not today. We're still operating on the numbers we allowed last week, which is 20. Yeah.
Yeah.
Is it 20 and 20 or 20 and
20.
Yes, 20.
Yeah, 20.
Okay, to ask about the hunting season. Any feedback on that?
No information to be added today on hunting and hunting dogs today.
PM, if I may assist, we did give permission, the Minister of Agriculture wrote to me, so we did give hunters permission to exercise their dogs. But no hunting.
Having said that, the hunting season is not open.
Correct.
Normally it would have been open from October 1st, is it?
Yeah,
Yes.
correct.
So we have not opened the hunting season, and so that exercising of the dogs
It's normal.
is something, it's one of those nebulous activities. But we trust that it will serve the purpose for the moment.
Okay.
Well, thank you all very much. You have a non-COVID question? Okay, so we are going to move on now from COVID activities to other questions. Right? So tell that to your people on the phone, right?
Yes, actually, this is from a co-worker who's working on a national security article. But of course, to the Prime Minister, do you think that matters raised in this Scott drug report in 1986 still exist in the police service today, or have things gotten worse? And are you confident under the current leadership that rogue elements will be successfully prosecuted in the DTPS?
That's a question for another time. I mean, I don't really want to get into that today. Scott drug report is not really in front of us. What is in front of us is the current state of affairs of a police service that is committed to protecting and serving. And what we'll try to ensure is that it's fit for purpose. That's it.
Yeah.
Thank you all very much for coming. Thank you all very much for your attention.
That was a media conference hosted by Prime Minister Dr. Keith Rowley, giving an update on the COVID-19 pandemic in the country. I am DK Rostar. Stay with us here on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online for the latest in COVID-19 and other news.